And our first order of business is to approve the attendance remotely of committee person Rachel Relaford. Betty and Eden, okay? Any questions? All those in favor? Aye. Any nays? Okay. Welcome, Rachel.
Thank you, Sharon.
Okay, so our next order of business is approval of the minutes, August 24th, 2021. Can I get a motion, please? Linda, second for Rob. Are there any questions, additions, deletions, clarifications? Okay, all those in favor? Aye. Any nays?
Aye.
Okay, moving on. I need to delay so we can get our vote. Okay, our first order, well, we're going to have a presentation for Peoria County Triad. And do we have Mike here? Mike Bierce. Hi, Mike. Would you like to grab a microphone? And you could probably...
Want me to stand or sit?
Well, I was going to say maybe you could come to Brian's seat there and
All right.
Okay.
Thank you.
Good morning, Mike. Welcome.
Working good here? Is this good?
Yes, yes,
All
thank
right.
you.
Peoria County Oh, does it stay on for?
Yes,
Okay.
it should, yes.
Since about the 1980s, the National Sheriff's Association actually started to try to get into the communities and especially seniors groups. And that was simply because of the baby boomer thing. They were trying to get the lead on that and make sure that they understood what they were dealing with from a law enforcement perspective. And since 1999, Peoria County Triad, which was begun to bring senior citizens, at that time health fairs were the big deal. And so we would congregate a couple times a year with seniors from all over, primarily senior living communities, which were gaining steam back then. So then we would have the business leaders who were a part of the primary triad group, and then we would have our law enforcement representatives, typically from the sheriff's office and at that time the Peoria Police Department. And everyone would get together and do their presentations, and we would hand out the files of life. Show of hands, how many people know what files of life is? One? Okay. Files of Life was also started back in the 80s, and that initiative was primarily to make sure that seniors could have a list of medical conditions and medications, contact information, and they would put it in what still is kind of a little red magnetic binder, and then they would put it on their refrigerator so that when a first responder would come to the house, they would know where to go and that the information would be there so that they could take appropriate action. So that's has been, since 1999, one of our core efforts when we get together with seniors. So fast forward now, regardless of zip code, Peoria County Triad works to provide safe local forums where discussion topics on health and safety and welfare, which in broad terms, because of our membership, we have different health topics. Safety traditionally are home environment kinds of things, as well as we have representatives from the utilities, Ameren. I almost said Silco, so that tells you how long it's been for me, but yeah. So typically we would have those folks come in and talk about some of those kinds of safety issues. And then we also would have folks come in and talk about what to do in emergencies, having go bags ready and contents and those kinds of things. These presentations would typically be followed by open Q&A, which would then allow seniors, family members, and as we have been focusing more on community dwelling seniors, we want to try to also get some of the neighbors of seniors in. And then they have an opportunity to ask questions of law enforcement, the presenter, and any other triad members that are there representing multiple different agencies, so they can get some of their questions asked and answered. In spring of 2021, the State of Illinois Elder Abuse Task Force, how many knew that there was that thing going on? A few, okay. The State of Illinois Elder Abuse Task Force handed in their final report, and it suggested reinvigorating and actually creating more Illinois triads as a resource for helping to combat the many health, safety, and welfare issues that community living seniors face. And as you all know, our new mayor and our new police chief, and of course, you know, this board have already for years been on the front line of trying to get more grassroots interaction between seniors and some of the other folks that are in the community and public officials, et cetera. Because they recognize that the only way to curb violence, create safe communities, and support community economic growth is to facilitate community dialogue at the grassroots level. In our COVID recovery period, I say recovery, you know, in quotes, we've begun to utilize more of our partner OSF and their faith community outreach group. OSF in the Tri-County area has over 30, frankly she didn't have an accurate number, but she has over 30 faith-based locations where they are working with us to put these small groups together and keep them going on either a weekly or a monthly basis, depending on how eager the seniors in that parish or church or synagogue or what have you, however often they want to meet. So this group goes into these locations. They offer their education and professional services. And then we are also there to help facilitate the forums that we've just been talking about. As we expand to try to cover more ground, we realize that simply getting to a forum event, especially what we're finding in some of the south side, the very poor areas, getting to an event that's more than a few blocks away is a real challenge. And so consequently, what we've run into just within the past 6 or 7 months is that we have to try to come up with venues, locations that are really in what I would call tight community, 3 blocks or thereabouts, so that people feel safe going to and from. And, you know, it's complicated also because we have basically run out of money since COVID has made it a real challenge for us to get some of the grants that we typically get. I discovered that simply being a 501c3 means absolutely zero if you're not getting in front of people who have money to give you. And so consequently, that was another reason for me wanting to get here today, was just to get some ideas. I know in the triad that I was a member of before I retired back to Peoria 4 years ago, in Kane County, DuPage County, they actually had township funding as well as county funding. And so that's when I decided, okay, I'm going to give my neighbor Rob a call and see if I can't get in front of this group and find out what we might be able to do together. So hopefully this is a good introduction to us, who we are, what we do. And on the second page, I put a current list of members on there. We have a tentative list, prospective members that haven't been approved yet, and so we'll be adding 3 or 4 other groups here. But this has been the core group. It's a really good group, and we just want to continue doing what we've been doing and try to cover more ground. So if you have any questions, I'm right here for you to ask whatever.
Thank you, Mike. First of all, I want to thank Member Rob Renaud for hooking me up with Mike to have a discussion on triad. So I guess we'll open it up for questions. Are there any questions? Rob?
Thanks for coming, Mike. I appreciate the presentation. You'll have to refresh my memory. I know we have a member from the Sheriff's Department who is representative on triad. Do you get any support through the Sheriff's Department?
We get no financial support from the Sheriff's Department. There are a couple of representatives there. The one we typically have is Amy Chenal, and she was on the phone call with us here a few months back. And she is the one that is a victims' rights coordinator for the sheriff. And so whenever there is an identified victim who is a senior, she is the one that carries that through from initial complaint and police follow-up, and follows it through to whatever kind of resolution there is. So she is regularly part of triad.
Okay, thank you.
Mm-hmm.
Any additional questions? Okay. I do want to point out that his email is on the second page and his phone number. So if anybody would like to reach out to Mike, that's probably the way to do it. So, Mike, thank you for your time.
Thank you so much.
We really appreciate you coming. Yeah, okay, thank you. Okay, moving on. We are at number 4. We're at the budget. We're going to take those all in one motion. So I need a motion to get it on the floor. Phil, do we have a second? Eden? Okay. Scott?
All right, thank you, Madam Chair. For those that were in committee meetings yesterday, a couple of the slides in the slide deck will be a little repetitive because they talk about the budget at a high level across the entire organization in the general fund. But for those that were not here yesterday, or for those that may be watching the live stream or will watch it later, we'll walk through that in terms of what the recommended budget looks like for this year. So across all funds and all departments, the revenues or sources is recommended at $118.58 million, and the recommended expenditures or uses are at $121.88 million. Yes, those are not balanced. That is because we have some planned use of fund balance next year to that would then cover that gap. Two quick anecdotal examples of how we plan to use our fund balance. One is the enterprise finance software system that you awarded a contract to a vendor for earlier this year. We've been saving in the IT fund for a number of years for that project. FY22 will be the first year that we actually start paying out on the implementation of that project to the software vendor, and so that's one example. Another example that we actually talk about almost every year is the highway department saves up to do various road and bridge projects, and then once the reserves have gotten to a point where we can afford to do that road or bridge project, then we recommend the drawdown of those reserves specifically for that project. And so that's one of the things that's another example of how we're using fund balances in 2022. Property taxes, the recommended rate is 82.41 pennies per $100 of equalized assessed value. The supervisor assessments is, his estimate is that we will see a 1.1% increase in EAV, or the tax base for taxes that will be paid in 2022. The pie chart that you see, the blue shaded wedges are the operating funds of the organization. The green shaded wedges are the pension related funds. And typically, you would also see a red shaded or colored pie wedge. You do not this year. Red we designate as and show as debt service based on some short-term debt that we issued about a decade ago and paid off this year. We do not have a need next year to use the debt service levy. We shifted those dollars into the FICA fund so that we could shore up those reserves to meet some seasonal cash flow issues that we've been seeing. And then the other big change is we are taking the recommendations and implementing them from a study we had Bellwether prepare for us in terms of how we fund our risk management services. Risk management services being unemployment liability, general liability, and workers' compensation. We recommend to decrease the general fund levy by an amount that is shift over to the risk management levy. So that's Property Taxes 101 in about a minute and a half. In terms of across all funds, what your committee has oversight of, there's 4 budgets. All of them are special revenue funds. The recommended revenues for those 3 special revenue funds and 1 general fund department is $8,570,400. The expenditures are $9,982,570. The health department being the lion's share of both of those numbers. If you want to compare that to the other committees, your committee represents 7% of the revenues and 8% of the expenditures across the entire organization. In the general fund budget is balanced at $47,185,000 and change, almost $186,000. You can see by the chart on the screen that our largest revenue stream in the general fund is our intergovernmental revenues. That includes income tax, sales and use taxes, state salary reimbursements for positions that are in the general fund where we get those reimbursement dollars, and the general fund's share of PPRT. The largest expense are our personnel services, and that's shown as well at just under $32 million. In terms of this committee's oversight of general fund expenditures, your revenues are $19,000, which is less than 1%, and the expenditures are just a shade over $283,000, which is also just a shade under, or right around 1%. It's between 0.5% and 1%. So with that, Madam Chair, I'm happy to answer any questions of the committee, as is the budget and finance team.
Thank you, Scott. Any questions or comments? questions or comments? Okay, Rachel, did you have anything?
Not at this time, thank you.
Thank you. Okay, so we will take the vote then. All those in favor? Aye. Any nays?
Aye.
Any nays? Okay, that will be unanimous. Moving on, we are at informational items, reports, and other minutes and updates. So we'll start with the Board of Health.
Hello. To provide you a couple of updates, the big news that just got released this morning regarding Pfizer submitting data to the FDA, we're working with the ROE office. We had a call on on Monday to start planning on getting vaccinations to target that age range, which would be 5 through 11. So a lot of planning around that news. Again, it's expected for it to move through the FDA process and then through ACIP, and hopefully be able to be provided into arms by the 31st or the 1st of November. Likewise, we're in the middle of COVID and flu vaccination campaigns. I hope some of you were able to attend, but part of our CDC grant through the Illinois State Physical Activity and Nutrition Program allowed us to do a Complete Streets pop-up just right outside of Main Street. That was both on Friday and Saturday. We did have youth help do some data collection, as well as we will have a speaker later, a webinar on the 30th to kind of talk more about the impact of Complete Streets, not only from an economic standpoint, but also from a health standpoint. Our HUD work continues on full stream. We actually have been able to do above and beyond what was initially thought for this cycle. And then the larger news that we have is our community health needs assessment has been released. So we are now in the data collection process. And just to give a quick overview of that, in 2016, the IRS regulations that require our hospital systems to do a community health needs assessment and improvement plan every 3 years. Local health departments are required to do a similar needs assessment and improvement plan every 5 years, and that has been part of our code at the state level since late 80s, early 90s. So in 2016, we combined as a tri-county, so it includes 4 hospitals, OSF St. Francis Medical Center, the UniPoint Health System, Hopedale, and Eureka, as well as the 3 health departments. We just are now moving towards our next improvement planning process, which includes data analysis. So there is a community survey that's been released. We are doing it slightly different this year. We've historically analyzed our data at a county level. We're actually trying to look at it at a smaller level because we recognize that health impacts look different geographically. So Peoria County is actually going to be divided into 9 regions, Tazewell into 4, and then Woodford into 3. Just looking at a quick review of the data, we see we get a lot of feedback already from our urban center, the city of Peoria zip codes, as well as that goes into the Chillicothe, Dunlap area. Where we're needing a lot more survey results is coming from the western side of our county. That data will then, along with other data points, be consolidated down and presented to determine what our priorities and what our focus will be for not only the healthcare systems, but also the health departments for the next 3 years starting in 2023. More than happy to answer any questions.
Go ahead, Eden.
I had 2 questions. First, to clarify, Pfizer's data today is about the vaccine for 5 to 11-year-olds, correct? You just didn't clarify
Yes,
that.
it is for 5 through 11-year-olds, yep.
And with the flu vaccine out and COVID, are those recommended to take together or farther apart?
So you can actually take both of them together. Initially, when the COVID vaccine was released in December and January, there was language about waiting 14 days. As we've now had millions upon millions of people get vaccinated, they came back and edited that. So you don't have to have spacing between vaccines. Having said that, both vaccines give you a reaction. They give you an immune response. That means that they're working. And so if you feel that your body can handle getting both an influenza vaccine at the same time as COVID, feel free to do so. The bottom line is we want you to get both.
Jennifer?
In terms of the community health needs assessment, you said we need to see more respondents from the western parts of the county. What is being done to do that, and how can we help?
So we're doing it in a couple of mechanisms. We are actually using our own outreach workers to go out into those communities, working with church groups and other agencies to give hard copies of the survey and then collecting them later on for analysis. So we have staff actually canvassing the area. We're also working with community partners in those areas to educate them on what the importance of the survey is, but how to release it. And then on a broader standpoint, our Partnership for a Healthy Community, that board is made up of not only healthcare systems, but also key sector partners. So for example, our ROE sits on that, Greater Peoria Economic Development sits on that, our libraries, and so they are also pushing it out through their networks. But I think the biggest thing is that if you are able to share it as well, so they can see it on different avenues. Again, it's the one health assessment for this entire county, not only for ourselves, healthcare, and I believe also the United Way uses it for their own community assessment. So we try to consolidate it down to one.
Okay, any other questions? Oh, Phil, sorry, I was looking that way.
Monica, I wonder if you could speak to the Moderna booster, since that's what my wife and I will both be taking. I've watched carefully all of the news reports and so forth. I've never seen where it's been approved and released yet. Yet, I know for a fact that the two Hy-Vees here in Peoria have been giving the Moderna booster. I know for a fact that the Hy-Vee over in Galesburg, they administered the booster. Can you speak to us what? And I know my wife and I went by the health department to see if we could get it, and we did not qualify under any of those, but they didn't have 65 or over, or we would have been able to take it.
So I think there's an understanding that there's two different vaccinations going on. There is your original vaccination schedule. For most healthy individuals, 12 and older or 16 depending on the vaccine, you would be getting 2 doses of an mRNA vaccine, which is Pfizer and Moderna. If you are immunocompromised, whether moderately or severe, for you to have your first schedule of vaccination be done, you actually need 3 shots in total. So you'll need 1, then you wait your gap, and then another 28 days later, and that's for either Moderna or Pfizer. What the booster is for is after you've done your original vaccination schedule, whether it's 2 or 3, then you need to come out 6 months later and get a booster. Right now, the booster is only for Pfizer, and it's for, as you mentioned, 65 and older, individuals 50 to 64 with underlying health conditions, and then the other layer of that is people that may get it are 18 to 49 that have underlying health conditions, or individuals that work in these high-risk settings. This is, again, all for Pfizer. We expect Moderna to release their data points also this month for the booster as well. But if you are just seeking a booster vaccination and you've already completed your original vaccination schedule, it only currently applies to those with Pfizer.
Yet I know for a fact that the Hy-Vees here, as well as Hy-Vee in Galesburg, have been administering a booster for Moderna.
And we can circle back with the state on that. And again, it's also recognizing that you are doing this vaccination under someone's legal authority. Ours is under our medical director, Dr. Stoner. I can circle back to see whose authority that those 2 Hy-Vees are working under.
Any other questions? Okay. Is there a report for care and treatment?
No update for care and treatment.
Okay, and then I don't see Jason here. Is he here?
I will be Jason
EMA?
as well.
Okay, so
in your packet, just wanted to highlight a couple of things. Jason has been working on getting our multi-year training and exercise schedule up and running. So there was a collaborative meeting on September 9th related to that. And again, thank you to the ROE for also hosting a school safety day, which he was able to attend. We'd also like to highlight, you'll notice a lot of sirens are listed under equipment status needs. 3 of them are fixed, the ones in Kingston Mine, Hendricks Manor, and Dixon Cemetery. The biggest issue is not budget, it's parts. We don't have parts to fix it. There's a delay in getting those, I think, as with any other type of field right now. So it really is just a delay in getting those fixed as soon as possible.
Okay, any questions? Okay, thank you, Monica. Moving on, we are at ROE. Beth?
Hi there, everyone. Well, just letting you know that it's time for my annual colonoscopy with the Office of Auditor General. So the auditors are currently over in our office going through every receipt and purchase and grant and GATA and all those lovely things. So if you want to stop by and say hi. Okay, here are the updates I have for you. First of all, the most important one I want to start with. Your investment in our office of $15,000 for smart alerts. I wanted to give you a report because we had an action meeting this week. We are currently piloting in Illini Bluffs, Pleasant Valley, Pleasant Hill. Peoria Public Schools has this up and running. Just a reminder, it is a computer algorithm that when a police report gets entered into the system, it dumps in the morning by address, and it's around 4 key indicators: shot spotter, aggravated assault or battery, an arrest. I'm terrible about remembering what the 4 of them are, but they dump into the system. In the morning, the school gets the alert. And I was sharing with Rob that on the day of our meeting, Superintendent of Pleasant Hill was late, and she hops on the Zoom call, and that's because she had had a student that she had noticed that morning. She's like, "Good morning," and they were not having it. The address was in the system. And so they were able to, from the weekend, and they were able to wrap around this child, and this just happened yesterday. So your investment caused a child yesterday to get the services they needed, because once they could talk to this child, her weekend was absolute hell. And so that's just one example. And every school involved with smart alerts now is had at least one alert, if not multiple. And Peoria Public Schools is at 176 alerts already for August and September. So just let that sink in. Okay, so from there, I should say, and I will get emotional and I don't care, but what happened Friday at Peoria High School was the worst day of my educational career besides Sandy Hook. And I had a meltdown. I have not cried about COVID very much, just a little bit, and all the decision making that's had to go in, but that day broke me. It broke me hard. First of all, because someone I love works there, and I know that staff, and I know them well, and I love them, and I love those children. I'm on the sidelines of their football games, and I see what great things that they do, and it was just a really, really hard day. And it takes a while to recover from that. You know, you have a lot of people that, and then I asked Brian for a report, safety report Monday morning. He said it's the quietest place on earth, which I thought was funny. But what do you do? It's so big, systematic, because it's us. It's not Peoria Public Schools, it's us. And what are we going to do? And so the rest of my report will just be, I've had to circle back and say, Beth, you are doing things to try to tackle this problem one bite at a time, the way you eat the elephant. So sorry for the emotion, but that day I just howled. It was a really hard day. And I was wearing a Peoria High shirt because I was all dressed to go to football, and it was just a really rough day. So one thing, I happened to have that breakdown and crying with the staff of the JDC. So we were all meeting on the 4th floor over there because we have this exciting new concept, and I don't know why I didn't think of this before. We've been in Peoria County Jail teaching GED classes, adult ed, right? So we can hardly get into the jail because of COVID, and our numbers were struggling, and our grant numbers were in jeopardy. So we came up with this idea of a community classroom. So my director has that set up at Wisconsin Avenue by Heartland Health. And we have that set up for the adults. Why not for those that have experienced incarceration through the JDC? Because, stay with me, the Orphanage Act pays for the classroom situation at the JDC. That is Limestone Community High School credits. It does not translate well to Peoria Public Schools, and we're losing kids. So when they leave the JDC and come to Peoria, now they're behind and it's not translating. So we're setting up these adult education classes for those students. We think we're going to have maybe as many as 20 to 24 so that they don't have to experience that transition and we lose them and get back on the cycle. It's an attempt. We have the classroom times set up. It was a great meeting with the JDC. Also, my culture and climate director, my social and emotional learning director has been out to meet with the JDC staff. They are struggling, the educators that work there, not those that actually work at the JDC, because lots of the kids that are still there are some of the harder cases because the other ones have been dismissed due to COVID. And so really trying to provide some supports to that staff. So I'm excited about that. I had a meeting with PCAV. Why PCAV? Because my dad would go to the emergency room and I happened to walk into the ER of OSF on the day there was a double homicide. And I'd never seen anything like what I saw in the parking lot of the ER at OSF. And so I met with Becky Rossman at PCAV and we're starting to connect the dots to one another with what I can provide and connection to services for those that they're trying to make other choices. So that was a really great meeting and Becky and I have started communicating. We had Safety Day, as Monica highlighted, and on Safety Day, thank you to Peoria County Sheriff's Department. They came and did excellent presentations with our staff. It was our last time with Lieutenant Quast. He's just been such a great partner to work with. We had Jason Marks there, all folks going through safety because we can't forget about some of the other things we were working on before COVID hit, and that's keeping our buildings safe, active shooter drills, all of those kinds of things. I am putting my staff through a professional learning series through this calendar year called Relational Leadership, the idea of relationships and transactions and when they collide, and that's really coming up and bubbling up. I don't know about your organizations or where you work, but COVID's really impacting people, but there's still a job that needs to be done. And what's that line between those two things of honoring people's mental health, but yet I need you to do this? So we're really working through that with a former Caterpillar executive named Steve Avaska. And many thanks to Monica for our meeting on Monday. When she gets on the call, they're better behaved, the superintendents. So. And she went through a lot of the new guidance that we have for how we quarantine and exclude students when they are, and staff when they test positive. And then again, she highlighted the preparation that we're doing for the vaccine. So we've got a spreadsheet going and we're getting census numbers. Last but not least, I'm going to be sharing with you, because Jennifer just got this done, or I would have tried to have it in your packet. Annually, we produce our region report. What I want to highlight in this, I'll pass this around, hand it to the teacher here to pass out. What I want to highlight in our region report is you will see the mandated functions of our office on the first page past the logo, but then you'll see the value add of the things that we're able to bring to this county because of your small investment in our office, like Preschool for All, which is another way to combat what we're seeing with trauma and resilience and our needs in our city. So that is the highlight of all the things we did in our previous fiscal year. Oh, and I forgot to, this last thing. So what happens, the smart alert, I wanted to make sure to share this with you. If that smart alert hits, besides just taking that child aside and talking to them, what preventative things are we doing? So we are providing them with my other social and emotional trauma person that works directly with Lurie's, with my Lurie's contract for trauma training. She's doing that with the schools. And then we also have Holt coming in. So here's an example of what they'll provide for free to the school. So for kindergarten, they'll do self-regulation, calming down, managing your emotions, self-calming techniques for anger management. I don't know why that's just kindergarten. We could all use some of that. And self-regulation for 2nd through 4th graders, 5th through 8th graders, then they hit suicide prevention. And then we hit some of the mandated trainings for teachers and staff around QPR, which is suicide prevention, youth mental health first aid. We're trying to get that everywhere we possibly can because one of my staff members can train on that. Resiliency, wellness, and other specialized trainings. So I just want you to know that we're behind the scenes trying to provide the infrastructure for the staff to actually deal with these things, because as you saw from my emotion, it can be overwhelming in the moment, and you need those tools in your toolbox so that you're ready and you feel prepared. So That is my report.
Any questions, comments? Steve?
Not a particular question, more of a learning of, as you speak about social, mental, emotional health and the need, so those students can learn, right? If you don't address those issues, you don't create a fun foundational learning environment. I'll just leave it as that. It's quite a shift, I guess, from historical and how do we move ahead. So kind of looking forward, your smart alert numbers of 176, did you say, in the Peoria Public Schools in 2 months? This is good. I'm just trying to anticipate a little bit. Where is this? What's the right direction, the right goals? But where do you see this? Because I see you're on a growth curve of alerts, and we're going to identify more students who are in need of social, emotional, mental support. And I have a concern that it may overwhelm the resources and capabilities that we already have. I'm not against it at all. I'm just struggling to identify how do we serve that newfound requirement. It's kind of a question, kind of a comment. I guess I'm just learning.
Sure, so let's start with this. Just because we are able to put language to it and give it words and structure now doesn't mean it wasn't there. When I started in Peoria Public Schools in 1993, and this is all schools, this is not a Peoria Public Schools issue. This is across the board, across the country. As a matter of fact, side note, COVID research is showing that students are now developmentally presenting 2 years behind in their social and emotional development, just that being around others. 9th graders are presenting as 7th graders. Kindergartners are presenting as 3 and 4-year-olds. And so at Valeska Hinton right now, they're dealing with toddlers. And I can tell you from a fact, I've been there and my 2 best friends are there, and they would attest to that. So the 2-year growth development is really challenging, layered on top of what we were already doing. So we can, as a school system, we finally came up against, we can say that this is the agency's problem, the doctors, the mental health providers, or we can take this on. And as you see in Peoria Public Schools, they're taking it on with Derek Booth, and he's the head of social emotional learning. So there are standards. They're based on the CASEL standards, which are national. So there are standards of targets that you're actually teaching towards to try to equip the children with the skills that they need. But until you have the relationship and build those skills in them, then, algebra really is kind of second seat. And so trying to build that and meet their basic needs. But how do I say this? Right now, the adults are the bigger challenge. And so working through some of the social, emotional, and mental health needs of the adults. So a lot of that is also all of us working together to break down the stigma of that it's okay to get support in that, and it's okay to, because it's not okay to drive your child to the fight. And so how do we work through those things, all while being culturally sensitive, that you don't act this way in school because this is what a lady that looks like me says. It's got to be culturally sensitive, it's got to be relevant, and it's got to be timely. So there's a lot of moving parts to it, but if we don't take it on, the academic scores aren't going to be there anyway. It is a health crisis. It's a health crisis. It's not, remember the book that I shared with you, it's not about your bad, you're making bad. It is what happened to you and really trying to work from that space.
Eden, go ahead.
Looking at those 176 alerts in Peoria, were all those did all those lead to interventions where sometimes the alert not mean that a student was affected?
So those are coordinated through Derek Booth's office. And so they're able to respond in a manner through they have he has a department in the wraparound center down at Tree Wind. And so they have their own systems for how they respond to that. But we are working, step one was to get the alerts. And once you know something, you can't unknow it. So what are you going to do with the information that you are getting, and what structures and processes and procedures do you need to have in place? So we're also then struggling with the staffing shortage. We need paraprofessionals, one-on-ones, and all those other folks in the system that support kids.
Yeah, I guess I was just saying, just because an alert happens because of a certain address, it's possible the student wasn't
Correct.
actually impacted.
That is correct. And
Not
that is
saying that I'm sure most of them are, but
one thing that she does with Katie Kelly Johnson, one thing she does with Peoria Public Schools is help them disaggregate their data by school so they can look at their hotspots across the district.
Thank you. First of all, thank you for everything you do for our youth. It's truly appreciated. And I don't know if my comment will add value to what Steve was saying, but I think not necessarily making all of our teachers experts in this field, but at least bringing awareness to it is what's going to help. There was an example in the book that you gave us that there was a student who had a male teacher and was doing very, very poorly in the class, and they thought it was because the teacher was male. But come to find out, the teacher wore the same cologne as the student's abusive father. And that's what triggered the trauma in the student, and that's why the student was doing so poorly in the class. So I think just bringing awareness to the teachers is a huge aspect, rather than making them experts in the field.
Tools in the toolbox is our philosophy. I don't want to be an expert in trauma. That's someone else's job, but I need enough knowledge to be able to handle that in the classroom, because what I'm good at is teaching you how to read. So I just need enough tools.
Any other questions or comments?
Beth, if you want to email me the regional report and any narrative you want to go with it, I'll make sure it gets to the rest of the board members.
Great. Thank you so much.
Yep.
Thank you. Thank you, Beth. Okay, moving on. We're at solid waste management, or I'm sorry, sustainability and resource conservation, which is Becca. Hi, Becca.
Green light?
It's on now. Good afternoon. I just have a little additional information to add to the agenda brief. The first thing being the Household Hazardous Waste event was September 18th, and we had 685 people participate. 150 of them were from Tazewell County, 33 from Woodford County, and a handful from other counties, including Stark County and Fulton. And about 493 registrants were from, I think 492, 493, were from Peoria County, so predominantly from Peoria County. The IAPA was happy with the event and emailed Monday morning to say that we are on the books for next year as well. A date has not been determined. There is a little pilot electronics collection going on in Limestone Township tomorrow. It is a Wednesday morning. But Limestone Township is going to be doing the work for collecting those items and then transporting to the electronics recycler here in the county. So more information on that next month. In terms of composting, the kiosk should be put into place today at Peoria Heights. It's painted and ready to go. So I'll provide a little bit more about that as well. And if any of you need more information about that, I'm happy to provide it. The landfill committee, an update there. There is a small repair that was just a bearing. It looks like it's the entire fan that will need to be replaced at this point. Still falling under the 15,000 threshold for intergovernmental agreement, and the estimate is around 12,000 now. One thing that I think is really important that maybe you didn't quite catch is in the sustainability update at the bottom is that 54,163 8-ounce bottles have been used or have been filled with the water bottle fillers here in the courthouse alone. We also have them in PCAPS and a number of other buildings as well, JDC and other buildings. And then the last thing is the second quarter, utility usage is down considerably. 20%, electricity is down 20% over last year, and natural gas down 25% over last year. Headington Oaks is a big part of that. Headington Oaks in June for electrical usage was down 63% over last year, with most of the vaccine clinics, I think, were wrapped up by the end of May. April and May were still, even with the vaccine clinics being in Headington Oaks, was 27% less than previous year. Same thing with natural gas usage. June was 81% less than last year, with the building being vacant. And that's what I have, unless there are questions.
Any questions? I just want to add that Stephen Morris and I, he is chairman of Landfill Committee, had the opportunity to meet with the CEO of the new company that's purchasing PDC, which is GFL out of Ontario, Canada. I look forward to having a long-term relationship with them. We'll see how this all goes, but they're taking possession, I believe, on October 1st. So anything to add on that, Scott? Okay. All right. Any other questions, comments? Move on to resolutions. I'm getting there. Okay. Center for Prevention of Abuse Agreement for a LTC Ombudsman Senior Advocate. I need a motion to get that on the floor. Rob, second. Jennifer. We have Carol Myrna here, welcome, and also Kevin Nolan, correct? Okay, who's going to take this? You're going to tee this up, Shauna?
All right, thank you very much. So during the Headington Oaks closure process, through discussions that Scott and I had with various board members, there was an interest in making sure that we still had an impact in the community in terms of being able to help provide services to our seniors, especially the elderly population, just maybe in a little different fashion than what we were currently doing at the time at Headington Oaks. So as we worked through that process, I think there was a lot of discussion about maybe doing a senior advocate type of position. And through the course of those conversations, we became in contact with Carol Myrna and Kevin and their great team over at the center. And so in conjunction with them, we felt that our recommendation to you would be best served by partnering with their organization and creating an additional long-term care ombudsman within their ombudsman program / senior advocate. And I learned something new. So ombudsman is Latin, I believe, Carol, is Latin for advocate. So we still, because of some of the state and federal duties within that position and regulatory things assigned to that type of position, we still had to keep the ombudsman name within that program. But essentially what this will do is this would be the county funding an additional FTE at the center for specifically doing ombudsman and senior advocate work within Peoria County. So they will solely serve the Peoria County population, and they'll do standard long-term care ombudsman work, going into the various nursing home facilities within the county, handling any complaints that come in, and do complaint investigations through obviously what they're required to do from a statutory response. But then in addition, they'll serve as a resource for referrals. So if a family member says, hey, I'm having trouble filling out my Medicare or Medicaid application for my parents, I need help with placement assistance to find the right home for them, then Carol and her team will make sure that they're being referred to the appropriate experts within our community to help that family with their needs. So the scope of work is in your packet, along with the estimated, salary, marketing costs, all of that. I'm happy to answer any questions. And Carol, I don't know, you can probably speak to it way better than I can since you're the expert, but.
Yeah, go ahead. Go ahead. Any comments?
I think you did an awesome job. You're hired. Chairperson Williams and committee board members and Peoria County team, good afternoon. Kevin and I are very happy to be with you today. Some months ago, we heard from Peoria County and have been delighted to hear of the interest in a partnership involving our state certified advocates who visit long-term care facilities, not only to monitor conditions, but to perhaps speak for those who are unable to speak for themselves. It's one of our many departments at the Center for Prevention of Abuse. It's been in existence for 20 years. The center itself has been in existence for 46 years. So we work well with the long-term care facilities in all the counties that we serve. Peoria County is one of 6. But in all of our departments, including the Long-Term Care Ombudsman Program, we live out our mission of helping all people live free from violence and abuse every day. And we believe everyone deserves peace no matter where they're at, anytime, anywhere, whether it's at home, at work, in school, and most certainly in long-term care facilities. So we appreciate the opportunity to be considered, to work together in this important partnership. We value collaborations a great deal, and we're happy to answer whatever questions we can. But thank you for letting us be here.
Thank you. We look forward to working with you. Rob, did you want to make any comments since you worked very closely with me on this project?
Well, thank you to Shauna and to the Center for collaborating with this. I'm very excited. This was something that was important to me, especially after we were forced to close the nursing home, to make sure that our seniors in our community were taken care of. One thing that I appreciate about this venture is that we're going to be able to evaluate quarterly and then tweak to whatever that position will best suit the interest of our community. So I appreciate that it's not just one thing, that we can kind of adjust it as needed. So I'm looking very forward to it.
Thank you.
Thank you. Any other questions or comments? Okay, we'll call the vote then. All those in favor? Aye. Any nays?
Aye.
Okay, thank you. We look forward to working with you. Okay. We are at miscellaneous. Do we have any miscellaneous? No? Okay, then we will adjourn. Thank you.